Hello everyone, and welcome to Ask Dr. Kraus Neurosurgeon. Today we'll be talking about car accidents and spine injury. Car accidents are a serious problem, resulting in a great deal of harm to drivers, passengers, and pedestrians yearly. In the United States, according to the National Highway Traffic Safety Administration, in the year 2015 there were roughly 13 million crashes, 6.3 million police-reported crashes, 4.5 million property-only crashes, and 1.7 million injury crashes. This resulted in a staggering almost 2.5 million injuries and just over 32,000 fatalities. The economic cost of this was $242 billion, and the societal harm was over $800 billion in the year 2015 alone. Car accidents arising from motor vehicle injuries are the most common source of new spinal injuries, accounting for roughly 35% of new injuries in a given year. Depending on the nature of the injury, the human body may suffer different types of harm. The method and nature of the impact will have a significant effect on the type of injury suffered. Was the injury a high-speed impact? Was there a rotational component to the injury? Was the passenger wearing a seatbelt with a shoulder strap? Were airbags deployed? Was there a fire during the injury? Did the vehicle roll over during the crash? Did the vehicle strike another moving vehicle, or did it strike a stationary object? If there is a fire at the scene of the accident, the passengers may suffer burns, in addition to other types of mechanical bodily trauma. Depending upon the nature of the impact, and whether the driver was restrained or not, a number of mechanical injuries can occur. These include injuries to the spine, the brain, the chest, abdomen, arms, and legs, as well as the internal organs of the body, such as the heart, lungs, spleen, kidneys, liver, and other vital parts of the body. In the treatment of a patient suffering serious trauma to the body, a patient will typically be placed on a firm board by the paramedics in the ambulance which arrives, and taken to one of the closest hospitals which is equipped to handle such emergencies. Great attention will be placed to immobilizing the spine, and in particular the cervical spine. We will be focusing on injury to the spine in this discussion. After arriving at the hospital, a patient will be seen by a trauma specialist who will then determine what the next course of treatment will be. This could involve a neurosurgeon for the spine and brain, an orthopedic surgeon for the extremities, a trauma surgeon for the abdomen, a thoracic surgeon for the chest, and other medical specialists. Unfortunately, the nature of the effects of automobile accidents on the spines of passengers is inherently unpredictable. The extent of the spine injury depends on the types of vehicles involved, how fast they were moving, which direction they were traveling at the point of impact, and a variety of other mechanical factors, not to mention the age and physical health of the vehicle's passengers. Whether the passengers were restrained with a seatbelt and whether an airbag was deployed also play a role. Quick changes in direction, much faster than the body is normally subject to, with massive inertial forces behind these changes, can cause serious trauma with the spinal column. The body adjusts well to its own changes in direction when the body and the person can prepare themselves for the change. Such is the case with a football player being tackled when he knows in advance what to expect most of the time, and also, for instance, a fighter jet pilot in a high-speed turn when he learns and anticipates bracing for a high G turn. But when these large external forces occur in an unexpected manner, they act on the spine in an unpredictable way. The body doesn't have time to brace itself for the impact. They can cause strains and sprains of the spine, they can cause fractures of the spine, they can cause herniated discs in the spine, and they can cause bleeding in and around the spinal cord or nerve roots of the spine. When this injury occurs in the neck region, they can cause what is known as whiplash. This occurs when the body's cervical facet joints are hyperextended from the initial impact, Then they whip back as the reactive forces come through, which can cause inflammation and severe pain, as well as permanent damage to spinal anatomy, including discs, vertebra, and spinal nerves. These same enormous forces resulting from the impact can crush parts of the spinal column, fragmenting vertebral bone and disc material. These situations are particularly dangerous because if these shards of bone and other fragments pierce the spinal canal wall, which is the membrane structure that runs most of the length of the spinal column and houses the delicate spinal cord and spinal nerves, these nerves and the spinal cord can suffer irreparable damage. We depend on spinal nerves and spinal cord for interpreting fundamental motor signals sent by the brain, as well as interpreting sensory data collected from other parts of the body. The spinal nerves and spinal cord in many cases cannot heal themselves if they are damaged, often meaning that a spinal cord injury or severe nerve injury has drastic negative consequences for a patient's long-term mobility. Paralysis or other types of disability may occur. Whiplash, paralysis, numbness, weakness, pain, deformity, and bowel and bladder problems are all potential consequences of spinal injury resulting from automobile accidents. Paralysis may occur focally in a limb if the nerves to a limb are severed or injured. Paralysis can also occur when the spinal cord itself is severely injured. Bowel and bladder dysfunction may occur when there is damage to the spinal cord. Fortunately, many injuries sustained during motor vehicle accidents, whether they be car accidents or truck accidents, may be successfully rehabilitated with spinal physical therapy in the event that there is no permanent damage to the spinal nerves or spinal cord. As long as patients retain motor control, the long-term prognosis at maintaining their mobility through regular spinal physical therapy and spinal injury rehabilitation exercises is quite good. These rehabilitation exercises focus on rebuilding range of motion, flexibility, strength, and endurance, restabilizing the spinal column by core strengthening all of the core muscles along the spine and throughout the torso. Once patients complete a spinal physical therapy program, they are advised to continue the exercises indefinitely in a home setting in order to maximize benefits to their long-term mobility. Thank you very much for joining us today. If you have any questions or we can be of any assistance, please feel free to contact us. If you would like to have a question answered by Dr. Kraus, just complete the form at www.spinehealth.com/contact-us.php. In the contact form, you'll notice a box requesting insurance. In this box, just simply type Ask Dr. Kraus. Thank you very much for listening, and we look forward to seeing you soon next time.